Welcome to another session on the breastfeeding question answers which you all mothers have filled in the form. And today I'll take the live question answers. So it is all about Ask Me Anything session related to breastfeeding your baby. Any question you can just write in the chat box and I'll answer them. So first I'll take the questions which have already come on the Google form which you all have filled. And then I'll take the live questions. So introducing myself Dr. Tanima Singhal, and I'm owner of Maa-Si Care Clinic. And I have 14 years experience in maternal and child health. So I'm a lactation consultant and I am pregnancy coach. So right now I'm focusing on lactation because I see there is a big gap in lactation. Mothers are not aware about what all things they should know and a lot of things around lactation and breastfeeding. So today's session, I am taking sessions regularly about Ask Me Anything. So you can write your questions in the Q&A box. So first I'll start taking questions which you all have filled in the form, Google form. I'll take those questions and then I'll answer the live questions. So first question is from Mansi. Does sideline feeding position creates more gas in infants? So first of all, Mansi, it is nothing like that any position will cause more gas in the infants. So this is just a myth. It is basically you have to feed the baby well. And after feeding the baby well, you can just burp the baby. Once the baby is burped, the issues will be resolved. There is nothing like that. Any particular feeding session will cause any kind of gas to the baby. So don't worry about that. Sideline position will not cause any gas to the baby. So don't worry. Next question is from Jyoti. बच्चे को पास में ना सुलाने से दूध कम हो जाता है, ये सब लोग कहते हैं मुझे, क्या ये सही है? तो ज्योति, ऐसा कुछ भी नहीं है, ये सिर्फ एक मिथ है, एक भ्रम है कि बच्चे को आप बिल्कुल अपने पास सुलाओगे तभी दूध होगा, ऐसा नहीं है। अगर बच्चा आपसे थोड़ा दूर सो रहा है या आपको रात में नींद नहीं आ पा रही है, बच्चा बहुत नजदीक सोता है, कई बार हम मदर्स को डर लगता है कि बच्चे को अगर हम बहुत अपने नजदीक सुलाएंगे तो कहीं बच्चा दब ना जाए, ऐसे बहुत सारे मदर्स के मन में ख्याल आते हैं। तो ऐसा कुछ भी नहीं है कि बच्चे को आप बिल्कुल अपने से चिपका के सुलाओगे तभी आपको दूध आएगा, ऐसा कुछ भी नहीं है ज्योति। नेक्स्ट क्वेश्चन इज फ्रॉम रिचा. Why baby sleeps on the breast? So Richa, simple thing is why baby sleeps on the breast. There are certain reasons. If your baby is less than 6 weeks, so baby's sleep cycle is around 13 to 14 hours in 24 hours. So the babies are more sleepy usually. And when you take them on the breast, when they are full, they will sleep. But if you are seeing that the baby is feeding for 45 minutes, 1 hour, and the baby is sleeping, that means the baby is doing passive feeding. So what you have to see that when you are taking the baby on the breast, you have to see the gulping motions in the baby's neck. As how we drink water, you can see the gulping motion in the neck. So when you are seeing that the baby is drinking milk and you can see the gulping motions, that means the baby is drinking milk actively. But when you are not seeing the gulping movement in the neck, that means the baby is not drinking. Basically, baby is sleeping. So, and why does it? Mostly you would have seen when the babies are even sleeping, they keep moving their mouth. So that doesn't mean that they are drinking milk when they are on the breast. So active feeding and passive feeding. So your question was why baby sleeps most. If the baby is full, then the baby might sleep. Or if the baby is not getting enough milk and the baby becomes too tired, then they will sleep on the breast. So these are the reasons why this will happen. Or if the milk flow is very less, then also this will happen. Next question is from Nazmi. She says, my nipples are too small, what to do? So first of all, Nazmi, nothing about that you can't breastfeed your child if the nipples are too small. There is nothing, the importance of nipples doesn't there that you can't breastfeed your child if the nipple size is not correct. So basically what you need to do, you have to regularly feed your baby in a correct positioning. And when we talk about correct position, the cross-cradle hold is a very good position to breastfeed your child if you are facing any kind of latching issues. Next question is from Bhagyashri. How to improve latching during breastfeeding? So first of all, Bhagyashri, you need to understand the basic concept about latching. So basic concepts about latching is that the baby's mouth should be wide open. Most of the times when I see the mothers and I assess their latch, I see they are holding basically the nipple part. So if the baby is not feeding properly in a big mouth open, the baby will not be able to empty the breast faster and will not be able to drink more milk and will not be able to empty the breast properly. So in that case, what you need to do when you are bringing the baby on the breast, just don't take them inside. What you need to do, first tickle the nipple on the baby's upper lip. When you tickle the nipple on the baby's upper lip, the baby will open a small mouth. Will do like this. If you are seeing that the baby is opening a small mouth, then what you do, you have to just keep patience and move the baby front and fro. And this way, like you're teasing the baby and not giving milk to the baby. So the baby will open the big mouth and will do a big mouth open, and then you take the baby inside. This is a small tip, but a very, very useful tip. If you follow this kind of thing, the baby will open a big mouth and the baby will latch. Second thing is, most of the times when I see the babies are latched, they are like looking downwards. So as you can see, this part in the neck, if you're drinking something and your neck is like this, it will become difficult for you to gulp. So if you have to have your baby latch in a comfortable position, the baby's head should be little extended. So when you put the baby on the breast, just make sure that by this wrist movement, you just move the baby's head a little back. So when the baby's head is a little back, the neck will open and the baby will be able to gulp better. So this way, latching will be better. Third point is about the areola. Nipple should, like baby should not do nipple feeding, but when we talk about areola, areola is the black portion around the nipple, and the baby, we don't want full areola in the baby's mouth. It is basically the lower part of the areola which should be in the baby's mouth. And how you will make sure? The baby's lower lip should be on the junction of areola and breast. When I take consultations with mothers, I ask them to send small clips of the latching videos from which we assess and we tell that and we improvise on the latching. This way we can work on improving the latch. So you have to make sure that the lower lip of the baby should be on the junction of areola and breast, and the upper lip should be just resting above the nipple. This way latching will become better. And also you should see when the baby is on the breast, you should see that your nipple should be pointing towards the upper palate, not in the middle of the mouth. So this way the nature has worked very well. If you can just see right now that if you just touch your tongue to the upper palate, all of you do that. Just touch your tongue to the upper palate. As at the back side, you can see there is a dome. So nature has planned so well that the nipple of the mother should touch the baby's upper palate. So the nipple will become safe and secure, and there will be no pain and good latching. While if you touch the tongue at the back of your teeth, you can see the hard part of the palate. This this part of the palate should be on the areola, which is the black portion. So this way, the baby will be able to suckle on the areola and will be able to empty the breast faster and in a better way. So all these things will be better. It will help to improve your latch. And once the latching is good, the baby will be able to empty the breast faster in a more efficient way. And also how to make sure whether the baby has taken enough breast milk or not, or how to know whether the baby has emptied the breast or not. Once you finish the breastfeeding, just press the breast and see the color of the milk. If the color of the milk is translucent, that means that breast is empty now. Now shift the baby to the other breast. But if you see the color of the milk as thick white, that is the hind milk, and you need to continue feeding from the same side. If the baby is not ready to latch further, you can just pump the milk or express the milk. But give this milk to the baby regularly. This will improve the weight of the baby, and also it will improve your milk supply. So all these things are important when we talk about latching. Next question is from Bhagyashri. My baby is not latching properly. She's always refusing latch. When I forcefully feed her, she gets crying. So Bhagyashri, you don't need to forcefully feed your baby. If you forcefully feed the baby will develop nipple aversion, and which is not good. So what you need to do, every time when your baby demands milk, you first try. If the baby is not coming on the breast, it's fine. Just relax. You give the baby palada feeding or the bottle feeding, whatever you are giving. But in half of the feeding, just remove the breast, remove the bottle, and just take the baby on the breast. This you need to do for every feeding session. Just not doing once or twice will not help. Just do it consistently and persistently. And believe me, if your milk supply is good, if your milk flow is good, there are very good chances that your baby can come back to the breast from the bottle. But you need to do it patiently, and by perseverance, you need to keep moving into that. Next question is from Sarita. My baby is 1.5 months old and my breast milk is very low. Could you help me how to increase my breast milk? Good, Sarita. So 1.5 month baby, you can easily increase your milk supply. And what all things you need to do? See, first of all, you have to understand the basic concept of breastfeeding. It is like demand and supply. Sometimes what happens when the baby is born, baby is separated from the mother for any reason, or the baby is introduced formula bottles, and because of that there is not enough demand for our brain, and our brain starts reducing the milk supply. So in that case, we need to re-establish the supply demand chain. So how to establish the supply demand chain is frequently feeding the baby. 1.5 month baby, your milk baby would be coming on the breast. Now what you need to do, every feeding session, you first try to breastfeed your baby, and then you can pump or express the milk. This will create enough demand for your brain to make milk supply. And to support this process and get the things moving fast, there are a few other tips. Number one, you should have a good water intake, at least 3 liters of water intake. Second thing is do massage, oil massage and the warm compress. This will improve the flow of the milk. When there is warmth on the breast, when you are doing oil massage and when you are doing warm compress, the vessels will dilate and the flow of the milk will improve. So this will improve the flow of the milk. Third, when we talk about galactogogues, which are the medicines to improve the breast milk supply, I usually recommend mothers using the medicines which don't have any preservatives in that. Many mothers are using Lactair and Lactonic and Galact, Lactavase. When you just look at the containers, you will see the preservatives are added into that. And I don't want any of you to take preservatives in your diet. So the things which I recommend is Lactomagic powder, which is preservative free. And it is made with 30 to 35 natural ingredients, which not only improve the milk supply, it will also help to improve your recovery. So one thing is Lactomagic powder, 2 scoops 3 times per day with milk or water. You can take preferably with milk. Otherwise, you can take with water. And second is tablet moringa, which comes in the name of Moreco. So all these 2 things you can just regularly take in your diet, and this will improve the milk supply. Along with that, just have 3 liters of water every day. Do a massage and the compress, which will improve the flow of the milk. All these things are very important. And how you will know whether the baby is getting enough milk or not, and how to know whether the baby's formula feeding is reduced or not. For that, you need to check the baby's weight gain every week. So if the baby is gaining weight and your formula milk is coming down, that means you're on the correct path of improving the milk supply. So this way you will be able to improve your breast milk supply, and you will not face any issues related to low breast milk. But you should always see the weight gain of the baby and accordingly move ahead. Now, these are the things when the milk supplies, like formula milk is around 3 to 4 times, these things will work. But sometimes you might be needing some more support, like regular talking to a doctor or something like that. Or there are some other medications also for if the milk supply has become very low. In that case, I recommend you reaching out to our clinic's number, and they will guide you on about the online consultation details with our team of doctors. We have 3 more doctors with us in our clinic, and you can contact them or contact my team and get your consultations done, and you will get very good results with that. And most of the mothers who are reaching us, they are getting very good results. So you can reach out to the team and get one-on-one consultations with the Maa-Si Care Clinic doctors. Next question is from Ritika. My baby is 1.5 months old and she is unable to take breastfeeding directly. She takes breast for almost 20 minutes but not satisfied. So Ritika, if your baby is drinking for 20 minutes but not satisfied, that means you are facing low milk supply. I just gave you the tips about how to improve the milk supply. Please watch that or reach out to the team. If you have done everything and milk supply is not increasing, then please reach out to the team. They will just assess your case history and they will advise you accordingly. So Ritika, first of all, don't worry, it will improve. Just follow the tips which I am giving. Next question is from Priyanka. Hi ma'am, I have a 2.5 month old son and my some solution for this. So Priyanka, first of all, we are nobody to judge our body that we are filling the breast in 4 to 5 hours. Please don't do that. You don't know about the nature. You don't know about your body. It is incredible. It has given birth to a life. So never judge your body. Now you are saying that the breast filling time is 4 to 5 hours. What I would suggest, if you Regularly breastfeed your child, like supply demand chain, work on that, and you give that extra demand to your brain, the milk supply will definitely increase. And follow the tips which I just gave you about how to increase the breast milk supply. And 2.5 months right now, the baby is entering into growth spurt, so you might feel little challenging. So that's why I request you, you can reach out to the team, because now you should all understand the growth spurt periods: 2 weeks, 6 weeks, 3 months, 7 months, 5 months. These are the growth spurt periods, and the symptoms you will start seeing around 7 days that here, like before, and 7 days after. So around 15 days, you will have difficulty in breastfeeding your child, or giving feeding to the baby will be demanding again and again. You will feel that the milk supply has become less, but please don't worry, just keep moving. During growth spurt, you might not see the increase in the weight also, but that's perfectly fine. Once the growth spurt has passed, everything will be back to place. So all these things will work, and just follow the tips which I am giving you, and get your issues resolved related to breastfeeding. And every mother can breastfeed her baby, or every baby gets the breast milk of her or his mother. That is my passion, and that's what I work on, and that is my mission, that every baby should get his or her mother's breast milk. Next question is from Monica. My breast milk supply is very low. So Monica, I have just given you the tips about how to increase the breast milk supply. Just watch the recording and get your milk supply good. Next question is from Pooja. Overactive letdown, how to manage heavy flow milk supply? That's a very good question, Pooja, because this is a very rare finding where the mothers are talking about oversupply of milk. So Pooja, first of all, you are blessed to have oversupply of milk. Reason, many mothers reach out to me every day about low milk supply. Very less I get about heavy milk flow. So I understand that is also not easy, because when there is oversupply of milk and heavy letdown, the baby gets confused. The baby finds it very difficult to manage, because it's a small baby. The baby is not able to manage. So what you need to do, there are 2 tips into this. Hold the breast in U shape from below, and hold it and press it little back towards your chest. And then you breastfeed the baby. This way you are like obstructing the flow of the milk, and you can hold it a little back, so that like when there is a high flow in the pipe, what we do, we just hold it and make the pressure little less. So that same way. Still, if this is not working, then what you can do, when you are starting to feed your baby, just hand express some milk and then feed your baby. So this way the pressure will be little less, and your baby will be able to breastfeed. Third thing, what you can do, you can just lie down and let the baby feed from above. So the gravity flow will not be there. So this will help to feed the baby, and the baby will be able to manage the flow. Next question is from Aditi. Low breast milk supply, not able to satisfy my baby's hunger. So Aditi, I have just answered about low breast milk supply. Please watch the recording, and I've given very detailed tips about how to increase the breast milk supply. Next question is from Sandra. Combined breastfeeding and formula feeding, is it okay? Baby drinks only milk for 1 hour and sleeps. Need to give formula after. So first of all, Sandra, combined breastfeeding and formula feeding is fine. It is completely okay. Now, when you say baby is drinking only milk for 1 hour, that is a clear indication that the baby is not taking hind milk. Hind milk is rich with fats. It keeps the baby satiated for a longer hour, and also it improves the weight of the baby. That's why you need to give the formula milk to the baby. So what you do, first of all, active feeding and passive feeding, which I just told you, that if the baby is feeding for 1 hour, that means the baby is not doing an active feeding. You have to make sure that your baby should feed only actively. And that I told you how you can know whether it is an active feeding or a passive feeding. Second thing, the most important thing is that if you are just after the breastfeeding, just press and see the color of the milk. If the color of the milk is coming thick white milk, then hand express it or pump it out. It is very important for the weight gain of the baby, and also to keep the baby fuller for a longer time. So these things you need to follow, Sandra, to improve your breastfeeding experience. Next question is from Meenakshi, breast milk supply. I already answered about this, Meenakshi. Next question is from Sujata, latching issues. So I have given a very good, like, full explanation about latching in at the beginning of this webinar. You can just watch the recording and you will get to know what all things you need to import out for improving the latch. Next question is from Monica, low milk. I already answered Monica. Next question is from Mercy. How to maintain the milk supply after the treatment? Very good question, Mercy. So whenever any of our patients, once they establish their exclusive breastfeeding, then we reduce the medicines slowly, like gradually. And once the medicines are stopped, then the mother has to just continue with the supply and demand. Until unless you keep creating demand for your brain, the milk supply will always maintain. There is nothing like that. Once we have improved the milk supply will go back again. If you are regularly doing demands to your brain, the milk supply will definitely be there once your treatment is completed. So this way, Mercy, you can maintain your milk supply even after finishing the treatment. So all these were for today. And now let me start the live questions which are coming. I'll just take some questions from here. So first question is from Priya. Do we want to check baby's weight every day? When I check her weight, someday her weight is less than by 50 grams. If I stop formula for her, do she get enough milk? So first of all, Priya, you don't need to check the baby's weight every day. I ask you to check the baby's weight every week. Like Sunday to Sunday, you can check the baby's weight. And if your baby is less than 3 months of age, baby should gain around 150 to 200 grams in a week. If the baby is more than 3 months, less than 6 months, the baby should gain around 100 to 150 grams in a week. This way, you will get to know that your baby is getting enough milk or not. You don't need to check every day, because if you check the weight every day, you will feel so anxiety and so stressed. So please don't check the weight every day. And you said that if I stop formula milk, do she get enough milk? So you need to see the weight every weekly. Like if you are checking every week and the baby is gaining weight, that means the baby is getting enough nutrition. You don't need to give any extra formula milk because of that. So this way you can reduce formula. So I would suggest don't reduce formula milk suddenly. Always reduce slowly. So suppose you are giving 60 ml per feed and your baby's weight is more than what I just told you, then start reducing 10 ml per feed. This way you will be able to reduce the baby's formula feed. Next question is from Shobha. I have twin babies. They were born in 35 weeks, 3 days, premature. Okay, Shobha. So they didn't latch, started with palada and they nipples. Okay, that's perfectly fine, Shobha. So if your babies are not able to latch in the initial days, now they were born in 35 weeks, that's fine. What is the age now? You have not written here. So if your babies are able to latch now, you can just like alternatively feed them. So one time you can feed twin 1 and the second time you can feed twin 2, or by the football hold, you can feed both the babies together. So any of you who is having twin babies can breastfeed their babies together by the football hold. Football hold is an excellent hold for feeding twin babies. Next question is from Shobha. Now they're comfortable with the bottle and then start crying if I try breastfeeding. Achha, okay. So what you need to do, Shobha, every time when they are demanding milk, you first try to put the baby on the breast. And if they're crying, you give bottle. But once that they have taken half of the bottle, remove the bottle and take them back to the breast. This way, if you keep doing this consistently for every feeding session, slowly, you will see that the baby will start staying on the breast for few seconds. After few seconds, it will become few minutes. And then you will be able to get the babies on the breast. But the most important thing is milk supply and milk flow. For these two things, I have already answered today, how to improve the milk supply and how to improve the milk flow. Next question is from Nutan. My baby is 3 months, detected tongue tie at birth. I have been exclusively pumping and supplementing with formula. I experienced pain while breastfeeding earlier, and it took more than 1 hour per breast. Any solution? So if you are like sure that your baby has a tongue tie, then obviously you will be having to go for the pumping session only. But if you are not sure or you want to like double confirm, you can just visit to another lactation consultant and show them and get your tongue tie detected. If that tongue tie is like confirmed and they are not suggesting it with a removal without surgery, then obviously you will have to pump and exclude and feed your baby. So you can definitely, but increase the milk supply by pumping also. Many times we think that if the baby is not feeding directly on the breast, the milk supply will not increase. But it is never like that. You can definitely increase the breast milk supply and get the baby on exclusive breast milk by even pumping regularly. So don't worry about if you are not able to breastfeed the baby directly. You can pump and improve the milk supply. I have given the tips about how you can improve the milk supply today in the sessions. Next question is from Priya. How long it takes 6 weeks to empty breast? It is not like that. 6 weeks babies, usually they have growth spurt. As I just told you, like 2 weeks, 6 weeks. So 6 weeks baby will be having growth spurt. The baby will be demanding milk again and again. It is not like the baby will feed in 5-10 minutes and will be okay. The baby might feed for 10 to 15 minutes also and would ask for feeding again after half an hour, 1 hour, because 6 weeks is a growth spurt period. So if your baby is demanding milk again and again, it's perfectly fine. It is just that because of the 6 weeks growth spurt, just hold on, just keep patience for 1 more week. It will be all okay. Next question is from Shobha. Can we restart breastfeeding after a gap of 2 months due to some health issues? Yes, definitely, Shobha. You can try. You can restart breastfeeding at any age. I have mothers who go for relactation even when their babies are 1 year plus, 2 years plus also. And there is a successful breastfeeding relactation story of a mother of 2 years plus baby, which is there on my YouTube channel. So we have a Mom Star series where the successful mothers interviews, we just post it on our YouTube channel. You can just type Dr. Tanima Singhal on YouTube and you will get that channel. And there are many success stories of breastfeeding, which are very, very inspiring to the other mothers. You can just go through them and you will understand about relactation and how relactation for Kiran, Mrs. Kiran, we did for a baby who is 2 years plus. And you can just watch that story on YouTube. Next question is from Nutan. Thanks, ma'am, for your advice and kind words. You're most welcome, dear. And since baby is bottle feeding breast milk, how to know when baby is cluster feeding, growth spurt, since we are the ones who give baby bottle and baby is satisfied. So now how you will understand about the cluster feeding? Cluster feeding, if your baby is like less than 3.5, 4 months, the baby will be doing cluster feeding once in a day. So it will be like usually in the evenings, but you will see a 4 to 5 hours cycle where the baby will be demanding milk like continuously. That is cluster feeding. Other than that, the whole full day cluster feeding sometimes will be due to growth spurt. So that will be on 2 weeks, 6 weeks, 3 months, 5 months, 7 months. So this way you can differentiate between a regular cluster feeding or a growth spurt cluster feeding. Okay, Nutan? Now let me take the questions which are coming again on this live on Zoom. So number 1 is from Monica. My baby is premature. I have low milk supply. How to improve milk supply? What to eat? So Monica, I just answered about how to improve the milk supply and what all things you can eat to improve the breast milk supply. Next question is from anonymous attendee. Ma'am, I have twin babies. I have milk, but one baby is not drinking. She is drinking for 2 minutes, then go to sleep. After burping and taking to the bed, she starts crying and she puts hand in their mouth. So one of the baby is not drinking. This is very common with twin babies where one of the baby comes on the breast and the other one doesn't come. So in that way, what you can do, you just feed the baby from one side, one baby, and the other side, the second baby. Usually this happens because they get habitual to the bottle feeding. So the same way you will apply the mid bottle feeding as I told you. First feed the baby and try to breastfeed the baby. And the baby is not coming on the breast, as you said, for 2 minutes, and then the baby sleeps. And when you put the baby on the bed, she starts crying. At that time, you give her palada feeding, katori feeding, or the bottle feeding, whatever you are giving, but only half of the amount which you usually give. After that, you put the baby on the breast regularly back to the breast. Now you have to see that the baby should be doing active feeding. If the baby is doing that, then it is fine. Just keep doing it for every feeding session. And slowly you will see the second baby will also start coming on the breast properly. Next question is from Divya Mutugi. Do nipples hole matter in milk flow, or because of less nipple holes, they sleep on the breast? No, it is nothing like nipples hole. But as the baby will grow, the nipples will become more, like you will see more holes, like more openings on the nipple. But that is the nature's regulation about breast milk supply as the baby starts growing. So don't worry, you have to just improve the milk flow and milk supply. So for milk supply, as I told you, hydration, lactomagic powder, Morocco tablets, and doing massage in the compress and checking the weight of the baby. And also, yes, one thing I forgot all of you, you have to keep the baby skin to skin with you. That is very important. At least 3 to 4 times you should keep the baby skin to skin with you. That will improve the baby's bonding, and also it will release relaxin hormone in your body, which will improve the milk supply naturally. And check the baby's weight. For improving the flow, you have to do oil massage on the breast and then warm compress. This will improve the milk flow and milk quantity. Next question is from Nandini. Myself, Nandini, my baby girl is 2 months old. I have tried all natural remedies to increase my milk supply and also breastfeeding my baby for every 2 hours following demand and supply. But my milk supply is not increasing. When consulted doctor, told it is hormonal issues, happens in rare cases. So I am giving formula milk since my milk supply is not increasing. Please suggest your opinion, ma'am. So first of all, Nandini, I don't believe in this kind of a thing that some hormonal issues will not improve the milk supply, but I would like to give it a try. So few of the things you can just see, just check any of your medical issues. Like if you have checked your thyroid, your sugar levels, your BP, etc. First check whether you do have any medical issues or not. If everything is fine, you have checked your thyroid also recently, then what I have suggested today about improving the demand and the supply in a way which I told you today about what, like doing it all together, increasing water intake, doing oil massage and the warm compress on the breast, taking lactomagic powder, taking Morocco tablets, doing skin to skin with your baby, and checking the weight of the baby every week. If you are doing this regularly and if you are seeing the milk supply going up, I'll be more than happy for you. So just try those tips and tricks. And still, if it is not working, we need to include one more medicine, which I can't tell on the common platform because it is an allopathic medicine. So for that, you need to just consult the doctors and they'll guide you there. So we have online consultations available at our clinic. You can reach out to the team tomorrow and you can talk to them and have a one-on-one consultation booked with our doctors. They will guide you. If you are facing all these issues and you have tried everything, in that way, you can just work. Next question is from Monica. Lactomagic powder, do we get in medical shops? You can get it online. You just type Lactomagic powder on online. You will get it on Amazon, Flipkart, and even on the website also. Next question is from anonymous attendee. Whenever I feed my baby, my nipples pain a lot. Even after feeding, I feel pain in my breast. What is the reason and how to resolve this? So first of all, pain during breastfeeding is because of a shallow latch. As I told you today's session, how we have a mouth, our anatomy of the mouth is made in a way to have a proper latch. So if your baby is if you just put the tongue on just behind the teeth, you will see the hard part of the palate. If this hard part of the palate of the baby is on the nipples, you will definitely feel lot of pain. So what you have to do, you have to extend the baby's head in a way that the baby's head should go a little back. So the chin should first touch the breast of the mother and then tickle the nipple on the baby's upper lip. The baby will open a mouth. If the baby is not opening a big mouth, just like bring the baby to and fro, like you're teasing the baby and not giving milk to the baby. So the baby will open a big mouth and then you lash the baby. And once the baby is lashed, just extend the baby's head in a way that the baby's head should become back. So you will see that the nipple will be pointing towards the upper palate, and that is the correct way of latching. In that way, you will not feel any pain. And when we have these kind of mothers who have pain in breastfeeding, we take their videos regularly and we have a dedicated latch expert in our team. So if you are facing difficulties with latching, you can reach out to our team and get your consultations done with our latch expert. Next question is from Anju Rana. Why my baby pulls on and off breast during breastfeeding? I have low supply in the past. So obviously, if the baby is not getting milk properly and in a good flow, the baby will pull on and off the breast. So in that case, you have to work on the flow and on the supply. So I have answered that, how to improve the flow and how to improve the supply. Just follow that, Anju. Next question is from Monica. How frequently should we pump the milk? Now it is always like you just breastfeed your baby first and then you can just check the color of the milk. If the color of the milk is coming thick white, then pump for 10 minutes. If the milk is coming thin like translucent, just pump for 5 minutes. This is only for the mothers who are trying to improve the breast milk, not for everyone. Next question is from Nuzhat. My baby is 6 months on bottle feed. I have no milk. I want breastfeed, please. So now the baby is already 6 months. Nuzhat, please don't wait. Reach out to the team tomorrow and get your consultation done so that we don't waste time further and get on improving the milk supply. 6 months is a big time. Now don't waste time asking tips how to improve the breast milk. Reach out to the team tomorrow, get your consultation and get your issues resolved as fast as possible. Next question is from Sandra. My baby goes into a fit of crying and refuses breast, accepts only bottle. Then what do I do? See, if you have tried everything, if you have tried all the tips which I gave you today, then I would say get peace with that. You just pump out the milk and give the baby. So right now, the most important thing is to give breast milk to your baby. If you have tried everything, please don't bang your head there. It's okay. It's fine. Accept it. It's fine. Don't try to fight with your child. If you have done everything about direct breastfeeding, and if it is not happening, at least you can pump the milk and express out the milk. Now pumping is not so difficult. These days, wearable pumps are available. You can wear those pumps inside your bra and you can do your works. So there is nothing like it is becoming so difficult with the pumps. These days, so easy pumps, so small and compact pumps are available. You can use those pumps. So try to breastfeed your baby. I'm not saying that you don't breastfeed your baby. But if the baby is not breastfeeding and you have tried all the tips, then just don't go depressed. Just don't feel so bad. Just regularly pump out the milk, express the milk and give it to your child. Your baby should get breast milk. If it is by the breast, that is the best part. If you can give it by bottle also, it is also perfectly fine. So just do that. And once your milk supply is good and you are doing pumping regularly, in between you can try to feed the baby when the baby is little sleepy. So if the baby comes on the breast even that time, that is perfectly fine. Recently, my 10 months, one of my relactation mother whose baby is 10 months old, she has started breastfeeding back. Nobody could have imagined that a 10 months old baby who has never breastfeed can come on the breast. And that day we both were so happy. She shared to me that my baby came to me on the breast for around 3 to 4 times. And we both were so happy. And baby is 10 months old. So just don't lose hope. Just regularly express the milk and give it to your child. Giving breast milk is more important than feeding the baby on the breast. So just remember that your baby needs breast milk. If it comes from the breast, that is perfectly fine. But if you're pumping the milk and giving in the bottle, that is also perfectly fine. That is ultimately breast milk only. Next question is from Divya. Acha, okay. Thanks, ma'am, for answering my question. Most welcome, Divya. नुजत मैम मेरा आंसर नहीं सुना मैंने तो आपने नहीं सुना तो इसका रिकॉर्डिंग देख लीजिएगा नुजत मुझे क्वेश्चंस क्योंकि इतने सारे आ रहे हैं मेरा इधर इंस्टाग्राम से भी आ रहे हैं इधर जूम पे भी आ रहे हैं तो आप इसकी रिकॉर्डिंग देख लीजिएगा आपको उसका आंसर मिल जाएगा नेक्स्ट क्वेश्चन इज फ्रॉम भावना मैम थैंक यू फॉर योर रिप्लाई आई ट्राइड लाइक दैट ओनली वन ब्रेस्ट इज फॉर वन बेबी एंड द अदर इज ऑफ अदर ब्रेस्ट I put formula milk and in the half I tried to give my breast milk. It is not helpful. She is not satisfied again and again go to sleeping. That's fine. I am okay. See, Bhavna, as I just told you, you keep trying it for 1 week at least. If you are seeing that the weight gain is good and the formula milk is reducing, then perfectly fine, Bhavna. If everything you have tried and it is not working and because you have twins, then in that way, please be peace with that. Regularly pump out the milk and give it to your babies. That is more important and more important to give breast milk to them. Correct? We all want the baby should have breast milk. But if it is not, like if you're not able to directly breastfeed, that is perfectly fine. Come on, girls. Don't worry about it. Your breast milk giving to your child is more important. Next question is from Monica. I have booked your lactation consultation on 23rd. Should I cancel that or can I start with Moringa tablets? No, Monica, please wait. We'll have the consultation on 23rd. Today is already 20th. So after 3 days, we'll have the consultation and I'll see. And if you have taken for any other doctor, that is perfectly fine. They'll advise you accordingly and then you start the medications with the correct dosages. Next question is from anonymous attendee. My alveolar area is large, so baby has trouble in latching. What should I do? So first of all, you don't have to give full areola in the baby's mouth. You have to give only the lower part of the areola. So in that case, if the areola is big and you are not able to give full areola, that is not what I'm asking. I'm asking only to give the lower part of the areola. And if even lower part of areola is very big, then also I would suggest you try. As the baby will keep growing, then the more part of the areola can be in the baby's mouth. You first try to put whatever lower part of areola can go in the baby's mouth, and slowly as the baby will start growing up, you will see that the more part of the areola will be in the baby's mouth. So that way you can work on the latch part. Next question is next question is from Anamika. How to make a deep latch? After so efforts, I am unable to make a deep latch. So for deep latch, there is a very simple tip. When you are getting the baby on the breast, touch the nipple on the baby's upper lip. If the baby is not opening a big mouth, just make baby to and fro and just tickle it again in a way that you are teasing the baby and not giving breast milk. The baby will open a big mouth and then you take the baby inside. Now, once the baby is inside, then just with this wrist movement, take the baby's head a little back. When the baby's head is a little back, you will see that the nipple will be pointing towards the upper palate of the baby. That is the correct condition for having a deep latch. This way you have to try, and don't think that this can be achieved in one go. You have to work on this consistently and keep sending these videos to your lactation consultant. Will keep guiding you on what all things you need to work on improve. So this way your latching will be improved and you will be able to have a deep latch. Next question is from Monica. I have 2 months, 10 days old baby. I was pumping as baby was not latching. Abscess got formed for twice and got operated. Why does abscess form and how to prevent it? So now, Monica, how many times you were pumping? If you were pumping less, then obviously you will have, that means you were having very good milk supply, Monica. And because you were not expressing the milk regularly, you got the abscess. That means your milk supply is very good, Monica. Now, even after getting your abscess drained, you can still improve the milk supply. Please don't worry that if you want, you will not be able to breastfeed your baby again. And also, if your milk supply is so good, please work on the latch. There are very good chances that if your milk supply is good, the baby will be able to latch properly. Sometimes what happens if the baby is not latching in a proper way and the mother is only able to give only formula to the child, the baby will, the milk will stay in the breast and thereby the chances of getting an abscess formation will be there. So in that way, Monica, and also keep doing massage and the oil massage and warm compress. This will improve the flow and you will be able to empty the breast properly. And also after every pumping session, just press the breast and see the color of the milk. If the color of the milk is thick white, you need to pump for some more time so that you are able to empty the breast properly. Next question is from Deepika Tripathi. My daughter's teeth is not here. She is 12 months. So for this, please you reach out to your dentist. I am not a dentist who will be able to tell you if your baby is not getting teeth yet and she's 1 year old. Next question is from anonymous attendee. Madam, whatever we eat, it is good for the child. Elders are telling that shouldn't eat this and that because baby cannot digest. Please suggest. So first of all, I don't believe in this. You can eat whatever you want. Breastfeeding is not a punishment to the mother that she shouldn't eat this, she shouldn't eat that. You can like have whatever you want. I have no problem with that. Just you need to breastfeed your baby in a way that try to like avoid giving formula milk to the baby. All these gas issues and all are mostly because of the formula milk And today, all of you, whoever are giving formula milk to the babies, just check the ingredients of the formula milk. And one thought-provoking question: what do you think goes inside the formula milk? What is formula milk? When we say formula, it is already a chemical when we are saying. What is formula milk? What is the source of formula milk? Is it dehydrated cow milk? Is it dehydrated buffalo milk? What it is? And if it is cow milk or buffalo milk, if you're thinking about that, do you think we have so much of milk present in our world that can fulfill adults and also make milk dabbas for babies? One baby can is able to like one dabba gets finished in 4 to 5 days. Sometimes it gets finished even in 3 to 4 days. So every baby is taking so many milk formula dabbas, formula containers. So do you think so much milk is natural milk is available in the world to fulfill the needs of humans? No. That's why when you say that I am not allowed to eat this, I am not allowed to eat that, the baby will have problem. I have so much problem with this. We don't think about what we are giving to our child. We are so concerned about the softness of the mattress, the softness of the baby's clothes, but what we are giving them inside, we are not sure about it. And we just don't think about it. But when it comes to breast milk, there are so many questions. Don't eat this, don't eat that, don't wash your head and feed the baby. There are so many myths around breastfeeding, where breast milk is the elixir for your child. That is the liquid gold for the child. And still, we have so many questions for the mother. Don't do this, don't do that. So please don't listen to anyone. You are a mother. You have a full control on your child's future. So please take an informed decision and get your breast milk supply improved and be confident about your body. If you can nurture your child in the pregnancy, you can definitely nurture your child now also. So please don't worry if somebody tells you that you don't have enough breast milk, you don't have enough milk. All these things are just random. Please don't listen to that. Just work on improving the breast milk supply, and that will improve your breastfeeding journey. Next question is from anonymous attendee. Can you suggest diet chart for 6 months baby? This is today's session is more about breastfeeding and about breast milk, and it is not about the diet chart for the babies. Next question is from Sandra. One lactation consultant said not to give bottle and no pumping because baby doesn't get breast microbiome and gut dysbiosis happens. Is it true? So see, Sandra, I would say that please don't go into so deep of the science. Right now, please give your baby the breast milk. If you are not able to give by breast, give it by bottle, give it by palada, give it by anything. And if you're so concerned about the bottle, about the plastic, you can give it in the glass bottle, you can give it in the stainless steel bottle. That is perfectly fine. So most important thing is to give breast milk to your child. It is not about what is the container. Yes, about plastic we can say, because we boil them and we just warm them, then the microbiome obviously changes. But you can give in stainless steel bottle, you can give in glass bottle. That you can do. But I would say that give breast milk to your child as much as possible. Next question is, I think I am done for today. Last question is from Sandra. Is sideline position safe? My baby has started choking and crying. And obviously, if you are having choking and crying, please don't feed in the sideline position. Every baby is different. Every mother is different. Every technique is different. So maybe your baby is not liking the sideline position or is not able to feed with the sideline position. So you can sit and feed the baby. You can follow the cross cradle hold. You can follow the cradle hold, or you can follow the football hold. Any hold you can follow unless the baby is safe and secure. That is perfectly fine, Sandra. So good to see that I have answered all your questions. If you have any other, basically I have covered today about low milk supply. I have covered about latching. I have covered many other questions. You all can watch the recording of these sessions. It is all available freely. So the Zoom recording will be available on my YouTube channel, and the Instagram recording will be available on my grid. You can just check it out and watch them. I am always live every Friday on 8 p.m. I get live and I answer your questions related to breastfeeding. So that's all for today. Take care, everyone. Have a good night and enjoy your breastfeeding journeys. And please take care of your babies. And the weather is changing right now, so take care of your health also. And mother, you are also so valuable and you are so precious. So please take care of your health also. I understand babies are very important in our life, but take very good care of your health also. So take care, everyone. Bye bye.